Hello, everyone, and welcome to the Activating Youth Activism podcast. My name is Simphiwe, and I'm so happy to be your host today, where we will be addressing two critical health issues: front of pack labeling and the health promotion levy. On this episode, I've got with me two incredible guests, Lea Castro from UNICEF and Petronell Kruger from the Healthy Living Alliance, and they'll be sharing their insights on the health promotion levy and its role in promoting healthier lifestyles. But before we get into that interview, I want to focus on front of pack labeling, a simple yet powerful system that can help combat the risk of non communicable diseases, especially heart diseases. Front of pack labeling provides clear, easy to understand information on food packaging, highlighting whether products are high in sugar, fats, and salts, key contributors to heart problems like hypertension and cardiovascular disease. Studies show that high levels of sugar, saturated fat, and salt directly increase the risk of a heart disease. By making this information visible on the front of pack labeling, FOPL empowers us to make healthier choices. Knowing at a glance whether a product is potentially harmful can really help reduce the consumption of unhealthy ingredients that strain the heart, lower blood pressure, and ultimately reduces the risk of heart disease. On today's interview, Lane Petronell will take us deeper into the health promotion levy, another important policy designed to reduce the consumption of sugary drinks, which also contributes to a healthier heart. Let's hear what they have to say about HOPL and its influence in healthier living.
I am exceptionally honored and privileged to be having Lea Castro from UNICEF as well as Petronell Kruger from the Healthy Eating and Living Alliance. Thank you both ladies so much for joining me today. Before we just jump into the questions, I'm going to start with Petronell. If you could just give us a quick bio of who you are and what HEALA is, the Healthy Eating and Living Alliance.
Fantastic. Thank you so much for having us in POA. So my name is Petronell Kruger. I have a PhD in law, and I've been working in the space of public health for the last 5 to 6 years. I'm specifically looking at using law and policy, such as the health promotion levy, to prevent non-communicable diseases, which we're going to talk a lot about today. And I'm the programs manager at the Healthy Living Alliance, which is a non-for-profit established in South Africa doing work on what we call food justice. And what we mean by food justice as the Healthy Living Alliance is effectively forwarding a society where we fix the food system so that everybody in South Africa has access to enough and specifically nutritious food. So we're, of course, very concerned with key policy interventions like the health promotion levy, because that is a way in which we believe South Africans can have a better and more dignified life through better and more dignified eating.
Thank you so much, Petronell. And now, Lea, I'm going to pass the floor over to you. Just also explain who you are and what UNICEF's role is in the topic of the health promotion levy, especially considering that we are in World Heart Day.
Thank you so much. And hello, Simphiwe, and hello, Simphiwe's listeners. Very, very happy to be here speaking about this very important topic. So I'm Lea Castro, and I'm the program officer at UNICEF South Africa working with nutrition and climate change. I've been working in the global health nutrition space since about 2016. And here in South Africa and with UNICEF South Africa, I've been working and we have been working as a team to similar to what Petronell described. So we also care about improving the food environment. We see the food environment as one of the most important factors that determines what we end up eating, and especially what children end up eating. As UNICEF, we are the United Nations Children's Fund. So we advocate for the rights of children, and we see access to nutritious foods and sufficient nutritious foods as one of the key rights. And we see it because it is one of the key rights of children, according to the Convention of the Rights of the Child and also South African Constitution, if we want to bring it back home too. So let me stop there. Back over to you, Simphiwe.
Thank you so much, Lea and Petronell. Now, Lea, you definitely mentioned the South African Constitution, and I know that it's Section 27, if I'm not mistaken, that clearly stipulates that every single South African has the right to access to sufficient foods. And I wanted to actually ask you that with the health promotion levy, how does this work towards what is written in the Constitution? But more specifically, how does this aim to protect children and youth from health risks?
So, Simphiwe, the health promotion levy is a very important policy of the government which contributes to improving the food environment. So these policies should never be seen in isolation. There is no one magic bullet. It should be accompanied by other policies and other initiatives. But the health promotion levy itself, which in very simple terms is a tax on sugary beverages, we can also call it in layman's terms the sugar tax, as people sometimes call it. Essentially, it's there to increase the prices of sugary beverages like sodas and so on, so that it discourages the purchase of these drinks. So, the more expensive these drinks are, the more people are discouraged from buying them. And that ultimately, although it may seem a bit weird or perhaps even a bit unfair, it is for the benefit, especially of children and young people, but it's for the benefit of the entire South African population, because we know that sugar is, and especially excessive consumption of sugar. I mean, if you have one drink every once in a while that is sugary or high in sugar, that's fine. But if you're drinking sugary drinks, if you're drinking soda instead of water every single day, the more you drink them, the more your chances of developing diseases like diabetes increase, the more your chances of overweight and obesity increases, and even, dental problems. If we're looking at children, dental problems are a huge issue related to sugar as well, but especially these longer term non-communicable diseases, as we call them. And indeed, related to World Heart Day, the heart is one of the organs that suffers the most in relation to overweight and obesity, and we know that sugar is one of the drivers of this. So the sugar tax is there to protect our population, is there to discourage consumption of sugary beverages by simply increasing the price. But that being said, it also encourages healthier choices. If you're not drinking sugary drinks, then you might be drinking other drinks that might be healthier. Ideally, water. We like to promote drinking water, although it might not be the most exciting option, but we can make it more exciting. But it also contributes to product reformulation, which is essentially if producers know that they will have to sell their sugary beverages at higher prices, then they might be encouraged to actually lower the content of sugar because of the sugar tax. And that's a major win as well, because that ends up making the products available to people healthier. And the last point I'm going to bring up now before I share my entire speech is funding of health programs. So some of the revenue, because obviously when you have a tax, there is money coming in to government, and a significant portion of this revenue is actually being used to fund health promotion and disease prevention programs. So then not only does it discourage consumption of sugar and it encourages product reformulation amongst manufacturers, but the revenue can also be used to fund programs that actually contribute to people's health. So that was a very long one, but let me pause it at that.
Now, when you speak about revenue, and Bridget, I'm going to throw this question to you. What I've come to notice is that since the implementation of the health promotion levy in 2018, there has not been a increase that sort of matches the inflation rates in South Africa, which then brings me to the drive of trying to push for this increase. Why are we so adamant in trying to push for this increase? What have we seen, or what has the evidence shown us in the reduction of sugary drink consumptions by the introduction of the HPL?
Well, that's a fantastic question. And I think what I want to start by just highlighting is why something like an HPL is critically important in South Africa and why it needs to be updated frequently. So to give you an idea, 1 in 8 children under 5 in South Africa are already overweight or obese. So that's double the global average. And last year's Statistics South Africa indicated that we've seen a 20% rise in mortality in non-communicable disease-related deaths. So that just effectively means that people are dying at a 20% higher rate of these diseases that we traditionally would have called lifestyle risks, but we don't use that term because we realize it's about food systems. But it's effectively diseases that we see people are susceptible to due to some risk factors. So one of those risk factors is diet. And especially when we talk about children, because other risk factors are things like tobacco use and liquor use, which we don't traditionally see children engaging in. And of course, we don't want children to engage in. So diet becomes a really key issue when we start to think about why there's such high overweight and obesity rates. And we need to curb that because at the moment, about 250,000 deaths each year are because of non-communicable diseases. And to just reflect on when South Africa was at the height of the HIV and AIDS pandemic, that sort of matches the rate of death we had during the AIDS denialism period. So in short, it's a health crisis. And it's a health crisis that should actually outweigh something like COVID. And we've seen how government really intervened when we had COVID coming into South Africa and taking quite serious steps. But yet, for the entirety of COVID to date, we've not had as many deaths as we have per year for non-communicable diseases. So that's why we want to have these policies that make sure that we have better diets. Now, in terms of why we specifically want to have a health promotion levy, studies have shown that even drinking one soda a day increases your chance of getting diabetes by 25%. I know it's World Heart Day, and I haven't seen a comparable study necessarily on cardiovascular disease or heart disease, but there's a very clear affiliation with higher sugar intake and heart disease. So this is something that's a very easy way for us to intervene and make sure the diets are better. And it specifically is targeted to children because children are more likely to have additional sugar come from soda than from any other source. So what have we seen? Well, we've seen some very interesting things. So since we've introduced this quote unquote sugar tax, we've actually seen in some instances, kids who are low consumers in South Africa drink about 2 sodas less a week. And kids who drink a lot of sodas drink up to 7 sodas less. Now, remember, I just said, if you drink 1 soda a day, you are 25% more likely to get diabetes. So the health promotion levy for some children have already reduced their soda intake by 1 a day, which is very significant. Something else that's really important is studies have shown that, especially for lower income families, that their sugar intake from soda has almost halved. That's very important because families who struggle financially are also more likely to be unable to cope with the burden of non-communicable diseases. Managing things like heart disease or diabetes or cholesterol is very expensive. And even if you use the public healthcare system, I mean, that's expensive for South Africans, but as a private citizen, it still is expensive from your own pocket. So you need to pay to get to your public health facility. Oftentimes you have to queue repeatedly because you don't necessarily know that you'll have those medications. So non-communicable diseases can often lead to what we call catastrophic health incursion. Or debt, which means that if you get the disease, you are likely to go bankrupt as a family. And through the health promotion levy and reducing the amount of sugar that kids and adults ingest, we're actually seeing that we're actively protecting families from this catastrophic health and financial risk.
You've answered the next question that I had, which was, we've noticed how a lot of lower income and rural areas face a higher rate of obesity and non-communicable diseases. And the question was, how does the HPL protect those people? But I'm going to rephrase that question to, how do we get those people in those areas to understand the importance of policies such as the HPL?
That's a fantastic question. And I think it's something that the Healthy Living Alliance, we're always grappling with how to ensure that South Africans understand more about how these policies promote their health. I think the one thing for us to remember is that the average South African wants to be healthy and people want the best for their children. So what we need to do is effectively counteract messages, mostly from soda companies, that negates that. So a really important thing beyond the sugar tax that we need to think about as a society, and when we entertain these other policy interventions that Lea spoke of, is putting limits on what kind of statements that for-profit companies can make about their product. So a big issue is a lot of people associate sugary beverages and sodas with wealth and with status, and also oftentimes, and unfortunately, with energy and sufficient caloric consumption. So people would say things like, children need energy to learn. But what we need to then do is limit the company's abilities to create the false narrative that these drinks can in any way be healthy for children. Like Lea said, promote water drinking, because even though it does have a high energy content, it doesn't have nutrients that goes along with that energy content. And actually, if you drink sugary drinks, you're less likely to feel full. So what would happen is children will still pursue food and still pursue calories. So they'll still want to eat more. They won't feel full. So they'll go home and still say they're hungry. And then they'll just have these extra calories in their bodies that will then turn into overweight and obesity later in life.
Lea, now when we're speaking about children, I know I'm a nerd, and so I like to read things and I like to be in policies. And I've even had friends make jokes that I read UN resolutions as bedtime stories, which might or might not be true. We don't know yet. But in terms of making policies, especially the health promotion levy, cool for young kids, how do we go about doing that so that they become active drivers towards pushing for an increase in the health promotion levy numbers from the current 11% to 21%? Because I know, having conversations with other young children, what we've come to realize is that we do have a lot of impacts and we do have a lot of power. And especially when we learn things and then we get to go home and we tell our parents about things, and they take it seriously because it's us saying that we want to put our health forward and we want to ensure that we're drinking more water or that we're pushing government to do certain things. And I've noticed that when parents see how much their children care about certain things, they also tend to join in the fight or the cause. So how do we make this cool for young kids?
Simphiwe, that's a great question as well. I agree. Children and young people have immense power to change things and to influence, their families, their communities, their schools. So as UNICEF, we're working very closely with children and especially young people on advocating for these issues. And I think you're definitely one of the dream children and youth in terms of advocacy because of your passion and because of your drive. But you're right, it's not always the first thing that children or youth find interesting or that necessarily their passion is there. But we've had really excellent experiences in trying to frame this issue in a way that is very personal to us. So each and every single one of us is affected by the food environment. There is no way around that. And especially if you come from a low income background, you will be even more affected because your choices will be more limited to the extent that one can even question if they are real choices. And I mean this by if the only shop, let's say tuck shop or supermarket or market that you have available in your area only provides unhealthy options, then you don't really have a choice. Then the only choice is the unhealthy choice. And these are issues that when we talk to children and young people about it like this, through their own lived experience, we see that the passion is sparked immediately. And these are issues and topics that are actually quite easy to understand if you talk about it like that. If you talk to children and young people about, hey, how often do you see adverts of unhealthy foods like these or these foods? Or have a look at this food packaging. What does it say? Do you know that this is actually a little bit misleading? Or can you see how this manufacturer is actually not being completely straightforward about the facts in this product or highlighting some things while actually the product is not good for you? All of these things. And I think this way of seeing it, which is not necessarily through the policy itself, because I think there can be a bit of, people can be a bit intimidated when they hear, oh, this policy, it sounds very high level and difficult to understand. But if you bring it down to people's lived experiences and how it affects them directly, the passion, as I say, it's sparked immediately. The outrage is sparked immediately. When we realize, and we call this sort of a penny drop moment or a light bulb moment, when there is that moment when, and we see it, children and young people, in that instant when they realize how much they're actually influenced and targeted by these food corporations and their advertisement and so on, they're keen to do something about it because it seems unfair, and it is unfair, and it's not okay. And that's why these policies are so important. And these are some of the ways that you can involve children and young people, and especially in advocating for these issues. You mentioned earlier, they have such a strong role to play in influencing others. And by not only teaching and, you know, increasing the awareness of children and young people around these issues, but also teaching them and empowering them in terms of advocating for these issues. That's something that as UNICEF we have a lot of focus on and have quite a few amazing experiences with, empowering them, children and young people, to become advocates, to become champions for changing and transforming the food environment. And we really see them as one of the key players in this space. And we have some really, exciting um, events coming up and a lot of exciting initiatives involving children and young people. And we see a change, and we see that it is making a difference.
Thank you so much. Now, one of the main focuses of the Activating Youth Activism podcast is in its name, to activate youth activism. And the best way that we tend to try and do that is to inform young people of the issue and then go on and inform them of how exactly they can be a part of the cause. So starting with you, Petronell, for our youth activists out there who are driven and who will feel passionate about this topic, especially after listening to everything that you and Lea have had to say, what is the next best course of action that they can do in their homes, in their personal lives, and also through HEALA?
That is a great question, Simphiwe. So my very first answer to that, especially to the youth over 18, is to exercise your democratic rights and make sure that when there are elections, to go and vote and to ask your political representatives about their health policies. I say that because this was a voting year, and again, we saw really low voter turnout, especially amongst youth. But exercising your democratic rights and making your voice heard does not stop in election years. Throughout any kind of exercise of public powers, effectively, this tax is just another law. You can make your voice heard on several occasions, and HEALA would oftentimes host platforms for youth and adults to do that. So when we have the budget speech coming up, make your voice heard, tweet at the Minister of Finance, listen in the news to opportunities to sign petitions, share your stories about why health interventions are important. We have seen when government listens to the feedback of the public, that they're very susceptible to the stories of people and hearing how people personalize it and actually see these interventions making a difference. I think as South Africans, sometimes we can be a bit jaded about our government, but the reality is that the average person in government is also a member of a family, a brother, a sister, a father, a daughter, a son, and they are open to the experiences of the South African public, and they do want to serve us. So if you, as a young person in South Africa, make yourself heard to policymakers, ask them questions and hold them accountable, it makes a massive difference. So one of the things that you can do to help support the Healthy Living Alliance and yourself is when the midterm budget speech comes up and there's an opportunity for you to make your voice heard, is to support and amplify our message, to push for the health promotion levy to be increased even more so that we can see even more South African families being saved from the devastating health and financial effects of diabetes and heart disease.
Thank you, guys. Thank you so much, Petronell. Lea, I'm throwing the same question back to you. How can young people in their personal lives and through UNICEF be a part of this movement?
Yeah, so I think Petronell covered quite a few of the points already, but let me just add to those by saying how can children and young people in their own personal lives be part of this movement and this transformation of the food environment? One of them that is very simple is literally just talking about it with their friends, with their family, telling them about these issues. If they want to buy a soda, maybe they can say, but you know how much sugar there is in this, this is unhealthy for us. And then slowly start transforming through the family, through the community. We see transformation in, big change and big transformation. It cannot just happen from the top level down. It also needs to happen from the bottom up. And these are some of the ways that children and young people can start influencing that. Another one is speaking to their local canteens or supermarket or tuck shop and demanding some of these foods or beverages that are healthier. So let's say if at the university canteen they only sell sugary beverages and there are no healthy alternatives, sometimes not even water. I've seen that. Go to the shop and ask for them to provide these options. The supply and demand concept is quite real. So if we start demanding for better health, better choices, better options in the food environment, better options will be provided if we insist enough and if we grow our voices and continue asking and demanding for these changes. And then through UNICEF, what we have is what we call a youth movement. I'm not going to share too many details about it because we're about to unveil it and to launch it officially during National Nutrition Week 2024, which is in about a month's time. But what I can say is that this youth movement, it's called Fix My Food. Simphiwe, you're quite familiar with it, but essentially it's young people from across the country who care about these issues, who have something to say, something to advocate through their own personal stories and lived experiences about how the food environment is affecting them and what can be done about it. So there will be opportunities for engaging with Fix My Food, especially around Nutrition Week, as mentioned next month in October. So please keep an eye on the UNICEF website and also the hashtag FixMyFoodSetA.
I really hope that today's conversation has shed light on both the fronts of pack labeling and HPL and how these policies can work together to help us make healthier decisions for our hearts and overall well being. FOPL helps us identify foods that could negatively impact our health. By avoiding excessive sugar, salt, and unhealthy fats, we can reduce our risk of hypertension, heart attacks, and other cardiovascular issues. Wow, spoke too much that the English has now finally run out. But thank you so much for tuning in to yet another episode of Activating Youth Activism. And don't forget to check us out on YouTube, Spotify, and iTunes.